Hello everyone, and welcome back to the Retreat Rehabilitation Center's YouTube channel. My name is Stella Kivuti, a counseling psychologist with the Retreat, and with me I have three brilliant psychologists who work with us, and I will let them introduce themselves, starting from my left.
Thank you. My name is George Waizaka. Thank you for having me.
Thank you, Stella. My name is Antipas. Thank you for having me.
And my name is Samuel Tuku. Thank you.
Now, these wonderful gentlemen all work at the Retreat at our three different branches. Thuku works at the Limuru Annex, Antipas works at Ngong Annex, and George works here at Limuru Main. Now, today we'll be discussing a very heavy topic, and oftentimes we find ourselves, we might be seeing it, but we're not sure what it is, or how to go about it. Today we'll be discussing about suicide. And I think the easiest way to start is by defining it. So let's start with Thuku.
Thank you. Suicide is one of the leading causes of death in the whole world, whereby a person intentionally ends their life, maybe because of some issues that they have in their life.
When you say issues, what are we looking at here? Nikiachwa na mtu, is that an issue? If I break a favorite item, is that an issue? What exactly is that? Antipas, would you care to jump in?
Well, I think we can talk of risk factors. They're the ones that mostly predispose someone into those aspects of suicide. These risk factors could include some psychosocial issues, just to name stress, conflicts at home, or even at school, Yeah, just to mention but a few. Yes.
Predisposing. For myself, I do understand what that is, but for just our viewers at home, what would you define predisposing as, Antipas? Just break it down for me, please.
Well, I think these are some of the factors that maybe heighten or make someone to be at an increased risk of maybe
Developing
yes,
a certain condition.
sure.
Okay. So now let me ask. In my case, for example, I'm a woman in her late 20s, forever 18, but late 20s. What are the risk factors that exist for me?
So when you're looking at risk factors, there are a number of them. One of the risk factors for suicide is the gender or the sex of the person. Females are more likely to attempt suicide. However, more men die by suicide than women. This is because even though females attempt suicide more than men are more likely to use lethal means when attempting suicide. Then there's also the issue of age. People who are below 21 and people who are above the age of 44 are more likely to attempt suicide. This is because for people who are below 21, this part of the brain that is referred to as the prefrontal cortex. For people who are below 21 or 25, this part of the brain has not yet fully developed. This part of the brain is mostly responsible for rational thinking. Now, when a person who is below 21 years experiences something distressful, and they are not able to cope with it, they are not able to rationally think about that distressful situation, they act on impulse. And this impulse, in some cases, might be attempting suicide. Now, for people who are above 44 years, now this is where we have the symptoms of depression. Some people at this age have already been diagnosed with a chronic illness. And now, this being the case, for those people, they will have premeditated the whole situation. And by the time they are attempting suicide, we have already seen all these signs and symptoms of the said person. Again, another risk factor might be a lack of social support. Somebody who does not have a family, somebody who is recently divorced, somebody who does not have any social support can also be a risk factor. Yeah.
And probably to add on age, this prefrontal cortex is among the parts of the brain that are among the last to develop. Yeah, because the brain will develop from back forward, and this prefrontal cortex is among the very last parts to develop. So you find that, and since we are also focusing on the teenagers, you find that really this part has not either fully developed or it's yet to to form fully, and hence their decision making will be impaired or in a way be affected. Yes, yes.
Now, considering we've learnt about this, and we've also seen on the news, there'll be children as young as 5 attempting suicide, or even having the thought of suicide. What are signs that we can look out for? Because at some point you start to wonder, is this a moody teenager, or are they just having now the signs that will be leading up to that? Fuku.
We've talked about also mental disorders like depression being one of the risk factors for suicide. And actually, to detect whether somebody has suicidal ideations, we can actually look at some of the symptoms of depression that may actually point to whether this person might actually be having suicidal thoughts. So things like symptoms like withdrawing from people, having fatigue issues, headaches, aches, somebody who is a bit moody, somebody who is having issues, maybe challenges with appetite, with sleep, these people might actually at some point now start even verbalizing what they are thinking. And they might be saying, if I leave this place, you will not see me again. I am tired of this life. And so you might start hearing actually this person verbalizing what they are already thinking. And that is why we are normally told not to ignore such symptoms.
Now, when I hear these statements, or if I see this person is starting to withdraw, my child is starting to withdraw, or my friends are doing these things you're mentioning, what should I do? Hapo ndio nakimbia kwa pasta? do I chapanisha them? Do I buy them all the nice things to try and make them feel good? What's the option from there?
I think the most immediate thing to do is, as Tuku has said, is not to just take it for granted or just assume that it's a phase they are going through, but rather to take keen interest in why they are talking in such a manner or why they are behaving in such a manner. Remember, they will be kids or teenagers, sometimes they have the tendency of having this erratic behavior or even impulsive behaviors. They are watching movies, they are reading novels, they may want to attempt or to try some of the things that they are reading or seeing, watching in movies. But really, as a parent or as a guardian or as a responsible person, maybe you can think of a professional, and this professional is, you can talk to a psychologist who is trained, because they will be able to do the basic assessments, and from that point they'll be able to give an informed decision or an informed inference as to if this is an issue that needs to be looked into further and even offer possible solutions. And if the level probably of morbidity is high, they may think of bringing on board a medical doctor who has specialized in mental health matters, who we call psychiatrists. They'll also bring in the expertise, and if they need to intervene pharmacologically or using medicine, then they will be able to do that. Because we look at research, and there's increased or better clinical outcome when you combine a psychologist and a psychiatrist. It gives better chances of or better clinical outcomes. So once the assessments are done, then that is what will inform the best form of intervention. Yes.
Now I'm hearing these assessments. What exactly are these assessments? What do they do? George?
So these assessments are just one, if the person already is showing signs of suicide, to know the level at which this person might actually attempt suicide. Then during these assessments, since one of the trends that we see in mental health is that they usually start at usually the late teenage years. So we'll also be assessing for presence of a mental illness, so that by the time we are trying to chart away in terms of treatment plan, we also address all these factors that are coming up in the assessments. So when you know the nature of the problem, we now come up with a treatment plan, so that now we help this individual based on their own individual needs.
I'm liking where this is going, because already we've started talking about, okay, well, this is what I'm seeing, or this is what I could possibly see. And the people I should go to, the psychologists, the psychiatrists, if medication is needed, based off of the tests of the psychologist or the assessments that will be done there. My question, first of all, there, before we move into the aspect of is there any hope or treatment options outside of the medication, when it comes to these signs, is it possible for someone to fake them? Sometimes people might be seeking attention in one way or the other. Will the assessment be able to tell me this is real, this is not?
Of course, now that's why Antipas has talked about a professional psychologist who has experience in the assessments that George is talking about. Remember, when a psychologist tries to make an intervention, they're not only going to probably talk to this teenager who is having these ideations, probably the psychologist is going to try and reach out to the parent or guardian, maybe to the teacher, and maybe to siblings, so that first of all they can even analyze, has this teenager ever attempted or ever verbalized such ideations before? What was done at that point? What was the stressor that was stressing them at that point? So the psychologist is going to be able to analyze all this situation and now make a judgment of, is this just a coping issue that needs to be addressed? Maybe have a parent there and have a family session and deal with the stress, or is this person, does this person now require more personal therapy to help them maybe change their way of thinking and behaving and viewing life, or does this teenager actually need to be taken to a psychiatrist for now for the medication? Or a combination of all of those.
And perhaps to add on that, there are people who are actually going to fake the symptoms of suicide. And now during the assessment, usually there is even some mental illnesses that have that as a symptom. And now this is where the assessment is very important, because when you realize that this person is faking, you now tailor the treatment plan to actually address that specific mental illness. This is why the assessment phase is very, very important. Yeah.
And when I take this person, when I take this teenager into treatment, is it like 2 sessions and then we're done, we're good, everything will be sorted?
Again, that depends on whatever the assessment comes up with. Again, it depends on the level of morbidity, as he had said. Some people are just going to have a mild mental illness. Some people are going to have very severe mental illness. And for very severe, the person might even need to be hospitalized for some time. For people with mild and some moderate, we might need to go for sessions, sometimes 8, sometimes 12, depending on also the issues focused on during the assessment phase. Yeah.
Now, Antipas, is there any hope really? Because this, again, is such a heavy topic and it hits so many people, and sometimes for some of our viewers it might be very close to home. As much as we talk about 8 to 12 sessions, we talk about medication, is there any hope for dealing with this?
Yeah, indeed there is hope, because for us, we at the retreat, we are experts in dealing with such suicide, depression and other mental illnesses. So yes, there's hope. And because we have professionals or these clinical psychologists, they'll be able to handle those cases and they'll be able to tell, will this be a case of inpatient, whereby you need hospitalization, you need even more intensive sessions. Sometimes, because we are talking about suicide and you're saying it's such a heavy thing, sometimes you need to put these people under suicide watch, and that is some of the key things that will inform the professional on whether outpatient would work or not, alongside now the level of morbidity, either mild, moderate or severe. So indeed there is, and even when this patient has been discharged or when they are out of the risk now, there is also a need to do follow-up, or we call them mostly outpatient or follow-up clinics, because we talk about mental conditions as chronic illnesses, that really we focus on management. Yeah, there's no cure, but they can be managed, and one can live a very optimal life and be able to function, yeah, socially, occupationally, and then go back to their day-to-day functioning.
Oh,
Yes, yes, yes.
Now, I think in now closing, we've talked about the people who die by suicide, or the people who attempt suicide. What of the ones left behind? We've talked about the stressors themselves, and I feel like the stressor of losing someone or witnessing someone die by suicide is in itself a trigger to push me in that same direction. So what happens to those who know someone, have lost someone, or they themselves are struggling? Who should they call at this point in time? Who should they reach out to?
Of course, death is now a whole new issue that actually it will be important even to talk about that. Grief and loss. People cope or react to death and loss differently, and some people might actually now get depression, and now it can push them to suicide themselves. And that's why once in a while you'll hear in a family 3 people have died by suicide, for example. So I think in this same forum of advocating for people to understand mental illnesses, people to understand that psychological issues can be assessed, can be treated, and people can now lead normal lives. So these people might actually need themselves to be assessed further by a psychologist, find out how do they have coping mechanisms to deal with the loss of a loved one, and how can they be assisted to be able now to accept this loss and to be able to live a life that is not incapacitated by the feelings of sadness. Thank you.
Thank you so much, gentlemen, for helping me tackle this heavy topic. Now, for the viewers at home, if you do have suicidal ideation, suicidal thoughts, or you know someone who is having them, or you yourself have lost someone who died by suicide, please reach out. Ensure you talk to someone. Our contacts will be down below, and keep engaging with us. Thank you.